Welcome to all of you. I am Dr. Anil Menon, Professor at the Department of Endocrinology, Dr. D.Y. Patil Medical College Hospital and Research Center. And with me is
I'm Dr. Milind Patil. I'm Assistant Professor in Department of Endocrinology, D.Y. Patil Medical College. So, can we have brief questions regarding endocrinology?
Sure, Doctor.
Yes. So, Dr. Milind, my first question is, how do lifestyle changes impact the health?
Yeah, that's a good question because lifestyle changes have led to a second pandemic that we are seeing, a modern age pandemic of obesity. And obesity is linked to many disorders like diabetes, hypertension, generalized atherosclerosis. It increases our risk of suffering from a heart attack, strokes, we become more prone to cancers, and it also affects our mental well-being. In women, we have a problem related to irregular periods and primary infertility. So there are multiple problems which occur because of obesity.
So, this leads to the second question. So, if obesity and lifestyle is affecting health in this bad way, so what are the tips or advice you would like to give to the young adults to maintain a good health?
Yeah, so basically the change in lifestyle which has happened should actually be more akin to a healthy lifestyle. So one should basically eat a regular diet, avoid junk food, avoid snacking, do regular exercises, basically maintain your mental well-being, take proper sleep, avoid smoking and other addictions. I think these are the general tips that I would suggest to maintain a healthy lifestyle. So, Milind, I also wanted to pose this question for you that since we talk about sleep, does sleep affect hormonal health?
Yeah, sleep affect hormonal health in multiple ways. So basically, there is a cycle called circadian rhythm where the hormones are secreted in certain pattern. Like if we say cortisol, which is a stress hormone, which is secreted more in the when you wake up, and the level goes very low at the midnight level. Okay, so if your sleep cycle is disturbed, so the hormonal cycle get disrupted. There are other hormones like growth hormone. Then at the level of at the time of puberty, the LH, FSH hormones, the secretions is altered with the sleep pattern. So when you are having the sleep cycle disturbances, the cortisol levels the levels get fluctuated. Then it leads to the insulin resistance and it increases the risk of diabetes.
Yeah, and also there is a mention about melatonin,
Yeah.
which is a sleep hormone, and it can get elevated at times, at the wrong times, and when you want to sleep, that's the time probably it doesn't get elevated. So, what are the recommendations that you have for a sleep hygiene?
So sleep hygiene is a concept where a person should get adequate sleep. So he has to follow certain rules like having a light dinner. Second thing, don't taking the excessive tea, coffee, or any stimulant like smoking or nicotine at the night time or in the evening time. Then the second thing will be having the reducing the screen time. So which is now very difficult task in modern era. People stick to the mobile till late night and they complain ki doctor I'm not getting the sleep, and that's why I stick to the mobile, and that vicious cycle goes on. So first thing is in the sleep hygiene I will suggest that you maintain the sleep timings, like you stick to your timings, don't delay the sleep timings. Then the second thing is reduce the stimulant intake at the night time. Then reduce the screen time. At least 2 hours prior you should be off all your digital devices like mobile, TV and laptop, all those things. Then the other thing is having a regular exercise and wind down 1 hour at least prior to 1 hour prior to sleep, and reduce the artificial lights. I think these are the few tips.
Yeah, I agree, totally agree. That regular sleep-wake cycle, I think, should be maintained. Okay.
So with this thing, I would like. So with this thing, I would like to ask you, what are the recent advances or breakthrough in the field of endocrinology?
Yeah. So actually, the media attention has been brought onto a very important, important class of drugs in the last year, what we call as GLP-1 analogs. And these drugs have been used in patients with obesity, and they have shown a drastic reduction in weight. So there is a lot of talk about these drugs, and they are likely to be introduced in our country probably in this year. And secondly, for patients of diabetes who are taking insulin, that is once a day basal insulin, normally they have to take either daily or probably every alternate day. Now there is a once a week insulin, a depot preparation which has been introduced. So probably that I feel is the two important breakthroughs that everyone should know.
Yeah. So these are, I think, will change the game in the management of diabetes and obesity.
So actually now that we have established a department of endocrinology, do you have any suggestions for what are the warning symptoms that a patient should be aware that he has got an endocrine disorder?
So the endocrine disorders are heterogeneous. So we have multiple endocrine disorders like starting from diabetes related to thyroid hypothyroidism, hyperthyroidism, then bone related disorders, hyperparathyroidism, Cushing disease. So we can't make out one list where you can say these are the warning signs. So you should remember about the endocrine disorders. But definitely, if someone is gaining a weight which is in excess to the change in the lifestyle, that we have to screen for hormonal conditions, and other than that, it may cause the problems like diabetes, then hypertension, dyslipidemia. So definitely, I would say weight gain, a recent weight gain is a one warning sign where you might have to meet an endocrinologist. The other will be if you are losing a weight drastically, if you are having, despite increased appetite, if you are passing lots of urine, so that may be a warning sign of diabetes. Other than that, I would suggest diabetes is a silent disease, so it may present without any symptoms. So as per our Indian guidelines or recommendations by expert group from ICMR, we should screen all patients, all persons above age of 30 should have at least once in a year their blood glucose tested to take for diabetes.
That's correct. And do you see any specific group which is likely to be more prone to diabetes?
So in that, the people who are having family history of diabetes, those women who are having PCOD problem, those during pregnancy they had developed gestational diabetes. These are then obesity, then patients who are having underlying cardiac problem. All these are the high risk group where we should specifically screen for diabetes.
Yes, that's true. So what are your thoughts on intermittent fasting, which has been nowadays, it's actually very popular with patients of who are trying to reduce their weight?
Yeah. So the intermittent fasting, it includes two concepts. One is a few days you cut down your calorie intake more than 60%, and a few days in a week you have whatever you want to eat, or in amount. The second thing is time restricted eating, like you will eat only in 8 hours and 16 hours will be the fasting. So both the two things are considered as the intermittent fasting. So it's not something very new. It's since ages people are doing intermittent fasting, like in the Ramadan people keep the fasting. So it will be also one part of intermittent fasting. So now the people, there are both sides. Some are in favor, talking like it will cause weight reduction, it will help in improving insulin resistance and the glycemic control, and some are saying it may not work properly. So if we go with the evidence base, there is one meta-analysis which suggests that if you restrict the calorie amount, it doesn't make difference whether you are having intermittent fasting or you are restricting on daily basis in terms of weight reduction. However, there are some, it has found out that the people who are doing intermittent fasting, on non-fasting they overeat, they take more calories, and that may be a problematic thing.
Thank you,
And the
Dr.
second, last one point, in intermittent fasting, specifically if you are talking about diabetes, where you want a tight glycemic control, intermittent fasting may not be helpful, like the pregnant ladies with diabetes or type 1 diabetes who are on insulin. So in that situation, I think intermittent fasting should not be a first choice.
Correct. So I think they should take help of a nutritionist and decide what is best suited for them. Thank you, Dr. Milind, and thank you all. We'll come back soon with further information about other endocrine related diseases. Thank you very much.